Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman in Studio B here, garden level of the Holman House. And we're going to spend a little time right now at Sparrow Hospital with Dr. Paul Entler. He's the Chief Clinical Officer for Sparrow Health Systems. And Paul, usually I have a distinct question, et cetera. It might be good to just start and say, is there anything happening at Sparrow Health Systems these days?
Yeah, so a lot of, to say healthcare has been anything but challenging, disruptive would be an understatement. We going through the pandemic, and recently, the announcement came out of a partnership with a much more formal partnership with University of Michigan. So it's really an exciting time for us. We're really excited about it and what the possibilities are for our region, for not only for our attracting talent here, but also the care delivery models to our patients.
It's kind of interesting because you alluded to the fact that bringing it to a head and making it formal, there has been some of this transition working together in certain areas that's been going on for a little while.
Correct. So in 2019, there was a lot of out-migration of pediatric care from our region to the west side of Michigan down to Ann Arbor. And we really said, how do we get care and keep care here closer to home, and really start attracting subspecialties for pediatrics here and trying to keep, it's hard enough when you have a child that's ill, but having to move all over and navigate the system is difficult. So we formed a joint venture with the University of Michigan, Michigan Medicine back in 2019 to help transform the care delivery model for pediatrics here local to home. And we've been very successful with it.
Yeah, you really have. And along those lines, there was something back in the history of Sparrow, not too distant, with Mayo Clinic that really didn't work out quite as well. And it almost looked like you moved from Mayo to U of M to see if there was a better alternative.
Yeah, anytime when you're trying to transform a care delivery model, the patient's at the top. If you come into one of our facilities, you'll see that pyramid with the patient at the top. And so we wanted to look at how do we partner, putting a sign up on a building isn't going to change the care. The culture within that building is actually what drives the improvements. So while all the hope was that we would be part of the Mayo Care Network, this would be successful, it just made it very difficult if patients needed quaternary care, that really subspecialty care, to travel to Minnesota. And frankly, a lot of them ended up down at University of Michigan getting their care. So, it didn't work out as we had hoped. And so that's when we started looking at how do we partner with a brand, not only a state brand, but a national brand here, local, closer to home. And that's how a lot of this joint venture came to fruition. And then, leading up to this announcement December 9th.
So in formalizing this, what will this look like? Because we're all calling it a merger. Is it a merger?
It is not a merger. It's a member substitution. So there's a health corporation, University of Michigan. You have Michigan, UM Sparrow, and then Michigan Medicine. And so, again, it's the ability to still have local governance within your operations, but really, as I said, as we talk, to really capitalize on the synergies that we can across the continuum of care for our patients.
So it sounds like the change to Sparrow customers will be for the better.
That is correct. So, a lot of the subspecialty care, we take pride in our quality and safety here, and we're really have transformed some of our care delivery models here. This will only accelerate that for our patients, and also to be able to get a lot of the care maybe where they had to travel closer to home.
So will this mean transporting more patients to Ann Arbor and Ann Arbor to mid-Michigan?
It'll streamline the approach. So whereas if a patient is, especially in the acute care setting, so typically what happens now is if we have a patient that's critically ill that may need a service that we don't provide here, and that really subspecialty care, we're calling down a line of calls to different quaternary centers. this will streamline that approach to move patients much quicker. Some days they sit in beds waiting for days to go to those centers, so it'll help streamline that approach.
Well, and I'm kind of thinking of the burn center too, because that's one thing they do pretty well.
Correct.
Yeah. So let's talk from the business perspective. What will this mean to the business community? Because there's a lot of us that have been here for many years that are on your donor boards. In my case, even served on your health system board. What will this mean to us? What changes will happen there?
So there won't, obviously this has to go through the vetting process and the regulatory process, which takes time, but it really not much in terms of the local presence of donors or foundation. Those will continue to happen, and I don't want to use the word business as usual, because things will change. And this is, as we continue to work on transformation here, it'll transform over time, but for the time being, things will not change.
Yeah. Well, and it might be seamless to all of us on the outside too, which I think
Correct.
yeah, very good. Dr. Paul Antler, Chief Clinical Officer at Sparrow Health Systems. Thanks for joining us and clarifying a lot of stuff. Continued good luck, my friend.
Thanks, Chris. Have a good day.
Have a good holiday. You've been watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman. We'll be back with more.